Hi, everybody. My name is Salman Hirani. I am a pain physician at Oregon Health Science University in Portland, Oregon. I'm also a member of the American Academy of Pain Medicine and the Director of Innovation for AAPM. With me today, I have Dr. Sanna Lokhandwala, who's a postdoctoral research fellow and in developmental sleep neuroscience at Boston Children's Hospital and Harvard Medical School. Today, we'll be talking to you about the keys to wellness from pain to sleep. And so I'd like to start off by talking about two case studies that were in the British Medical Journal in the 90s. The first is about a 29-year-old construction worker who jumped off and landed on a plank that had a 9-inch nail embedded on the plank. When the gentleman hopped off and onto that plank, the nail went through his boot from one end to the other. And he looked around, everyone looked like they were in horror. He himself started screaming in pain. When he went to the emergency room and the emergency doctors sawed off the boot, what they found is that it had only pierced the boot. It actually never went through his skin. It actually went in between two of his toes, never piercing skin, never piercing bone, no blood, nothing. But yet he had pain. So was his pain real? Absolutely. Because of all the environmental factors that went into that experience, his body generated pain. In the second case study that we see in that same journal, another construction worker, a very dangerous job, a construction worker was using a nail gun and he accidentally set off the nail gun, clocked himself in the face. He looked around. He's like, you know what? I don't see a nail anywhere. Looks like I'm okay. He had some toothache, but he went to work for the next week. He went to work every single day. He was eating, sleeping. He had a dentist appointment that his wife had made for him because of the toothache. And when he went to the dentist, what they found was that he had that nail actually embedded in his skull going into his brain. And yet, this person had virtually no pain, right? Because everything around him, when he looked around, he didn't see a nail. When he looked around, his body really didn't generate pain because of the environmental cues. And so both of these are examples help us to identify what is pain, right? Because pain is very confusing to understand because it's such a personal experience. There's so much that goes into pain, and that's why the definition of pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. And so pain is complex and requires a comprehensive and multidisciplinary approach, and there really is no one size that fits all people. And so pain in NF, what we see is that intramuscular neurofibromas grow on small nerves in the muscles, and this can cause pain. Usually it can cause pain that's aching, throbbing, sore, almost toothache-like pain. And then spinal neurofibromas grow on the nerves that exit the spine. These are more common in adults than children. And if they grow large enough, these spinal neurofibromas can compress nerves and cause pain, numbness, weakness. And so a lot of nerve pain, when we talk about nerves, it's burning, stabbing, shooting, numbness, electrical burning sensations. And there's not a ton of information about pain specifically in neurofibromatosis, but we know because of the pathophysiology, we know because neurofibromas can grow into nerve cells, into the spinal nerves, that they can be painful and present very differently in different types of patients. And so what is this multidisciplinary approach that most clinicians in pain medicine now take? It means that it's not just the physician that you're going to see, or at least it shouldn't be just a physician that you see. Now in today's pain clinics, you'll have the physician, a psychologist that works specifically in the pain world, a physical therapist, nutritionist or dietitian, a nurse or care coordinator or health coaches, and then integrative health. And what we mean by integrative health providers is acupuncturists, massage therapists, chiropractors. A really multidisciplinary approach takes all different aspects of people that are working to address pain issues to help a patient. Because again, no one size fits all. Some people may actually prefer integrative health providers. Some people may prefer working with a physical therapist. Some people may prefer working with a psychologist. And some people may want all of these things. And so we almost have an option where patients can pick and choose what works best for their personal lives. And so when we talk about multidisciplinary health, then there's also the whole person health approach. And so the multidisciplinary is the different types of providers you'll see. And then the whole person health approach is about you as a person, all the different things that go into your life on a daily basis. That includes sleep, nutrition, activity, mood, social activities, and then your medication. It's important that we make sure we're addressing all of these things because studies show that when you have pain, it affects all aspects of your life. It can affect the social aspects. It can affect your mood. It can affect your sleep, and vice versa. Poor sleep, poor social factors, poor diet can all affect pain as well. And so it's important that we try and break all of these down and talk about them one by one. So nutrition, why is nutrition important? So serotonin is a neurotransmitter that helps regulate sleep, appetite, it mediates your mood. If you can think about antidepressants, serotonin like SSRIs or SNRIs are critical in helping address our mood or pain. And so serotonin, 95% is produced in your gastrointestinal tract, right? And so your GI tract is lined with hundreds of millions of nerve cells or neurons, and it makes sense that the inner workings of your digestive system don't just help with food, but also with your emotions, with sleep, with pain. And so it's important that a lot of the foods that we eat, that they are, you'll hear folks say your plate should have mostly green foods, some brown foods, but it should be a colorful plate. And that's because a lot of foods that we tend to eat that are tasty tend to be inflammatory foods or that are not necessarily the best for us. So foods that we want to avoid that can kind of flare or trigger pain include inflammatory foods, such as foods that are high in trans fats or omega-6 fats, and red meat, dairy, hydrogenated oils, simple carbohydrates, and then dairy. And all of this, when we talk about it, doesn't mean avoid it altogether. It means eating these things in moderation or being careful as to how much we consume of these foods. And then anti-inflammatory foods that are, that we can eat, without being as careful include green leafy vegetables, and then colorful vegetables, yellow, orange, red vegetables, citrus, looking at fruits and vegetables, fatty fish, and high fiber foods. These things are really beneficial, not just to your GI tract, but just to help with overall inflammation and processing of pain, mood, so many things in our life besides just our digestion. And then activity. Activity is so important. Every single time I meet a patient, I tell them motion is lotion, right? Our joints, our bones, our muscles, our tendons, they need to move. And so when you move less and less, your brain becomes accustomed to that decrease in activity. And as the brain learns pain, more and more activity becomes connected with that pain response. And so, there's this notion that anytime we are feeling some sort of pain, it's best to rest and relax. And that's true to a degree. But so many times I'll hear patients say, after I strained my back or after I felt this flare of pain, I rested and I stayed in bed for the next couple of days. And when I tried to move again, it was so painful, I went right back to bed. And that type of pain is because you maybe rested too much, right? Our muscles are now contracted, they're sore, and when we try to move, we feel pain. And it's our body's way of trying to communicate with us that I'm not used to this. It's not a signal saying don't move, it's just some pain or some difficulty in movement because your body is like, it's something I'm not used to. But there's a big difference between what I like to call hurt and harm or ooch and ouch, right? Ooch is pain that happens, you stop doing that movement or activity and the pain goes away. Ouch is the pain persists for days or weeks. That's what you want to avoid. So just know that not all activity that is causing discomfort or pain is causing harm. Mood. This is so important. So pain and mood are closely linked. Pain can make you feel stressed, down, worried. You can feel isolated or alone. And there's so much data out there that shows, let me go back here, that our mood, a poor mood can flare pain, and that pain can lead to poor mood, right? It becomes this very vicious cycle that can be very tough and hard to break out of. So it's important that we learn to manage stress. It's important that we seek help when we're not able to improve our mood on our own, whether that's through counseling or therapy, and then with, spending time with friends, family, loved ones, or engaging in fun activities that we enjoy doing. It's important that we work to make sure that people say it's okay to not be okay, and I think that's a little bit of a cop-out because it is sometimes very challenging to access things like therapy because of some things that we're going to talk about. But in today's world, today's age, we just had somebody talking, a speech pathologist, about AI and speech pathology. The number 2 use now of AI and ChatGPT is for therapy, for depression, anxiety, and trying to help treat mood. And so it's really important that we think about stress and how it impacts our body, and trying to make sure that we are doing what we can to improve our mood, because that in turn improves so many aspects of sleep and pain. And now there's so many different apps and digital technologies out there. These are just a few. We're going to talk about multiple others that have therapists behind those apps and activities that can help with anxiety, depression, and mood. And so going to that multidisciplinary approach and talking about digital health therapies, there's Curable, Empowered Relief, Kaya, Hinge Health. There are so many digital health therapies that if you live in an area where you don't have access to a pain psychologist or a pain physician or a physical therapist, it is possible through digital health therapies to access those regardless of where you live, as long as you have an internet connection. And I think some of the most important therapies are the behavioral health therapies. So behavioral health interventions serve as the gold standard evidence-based intervention for chronic pain. When you see a pain doctor, the first thing that they should be thinking of is not what procedure or what injection can I do for this patient, right? You want them to be thinking about who else can I bring into this picture to help this patient? What is going to serve this patient the best? And one of the things that every pain doctor should be doing is bringing in behavioral health interventions. Behavioral health interventions are low risk because they're non-pharmacologic, non-invasive. There's not necessarily negative side effects to just therapy. And therapies for treating chronic pain include cognitive behavioral therapy, acceptance commitment therapy, mindfulness-based stress reduction. And then something that's newer is pain reprocessing therapy. And there's still more data coming out about pain reprocessing therapy. But for low back pain, many patients find pain reprocessing therapy to be beneficial. I'm not going to go over, just for time's sake, all the definitions of the various types of therapies. We can talk about that afterwards in Q&A. But absence of mental health therapies leads to over-medicalization and a reliance on costly procedures, surgeries, pharmacology. And these are options that carry substantial health risks and may be ineffective really in relieving pain. And we know that access to mental health treatment is limited by multiple factors. There's a shortage of treatment services outside of urban areas. There's significant treatment-related costs. We know that not all insurances cover behavioral health therapies, and cash pay is extremely expensive and not accessible to all or most patients. There's long provider wait lists and a lack of clinicians that are actually trained in behavioral pain management. And so technology can play a huge role in helping bridge this gap. There are several now digital health technologies that have free access online, or they're covered by insurance, and they're clinically proven to help with chronic pain. And so these things include Curable, Empowered Relief, Flowly, Relieve VRX, Applied VR, and then some multidisciplinary companies like Vori, Override, Menda, Cove, and Lynn Health that all use pain psychologists to deliver one-on-one therapy or group therapy. And again, these are some of those apps here. Curable uses mindfulness-based stress reduction. Train Pain uses biofeedback. And then you have Flowly, Applied VR. and Relieve VRX that uses VR to deliver these behavioral health therapies like mindfulness-based stress reduction. And then the apps that we talked about that include pain psychologists and pain physicians. They're all multidisciplinary clinics now where you can access multiple types of providers in one app. Empowered Relief, one that's had massive success. Empowered Relief is a 2-hour session that you take in a group setting. And it's been shown that Empowered Relief has the ability to deliver 12 weeks worth of cognitive behavioral therapy in a 2-hour session. And so Empowered Relief is available across the country. It was developed by Beth Darnell at Stanford University, and multiple physicians across the country have trained in this, not just pain physicians and not just pain psychologists. And so here's again, clinician-delivered treatment interventions that can be accessed through the medical setting. And so, there's these digital health therapies. The one issue is that, of course, you're not in person with your provider. And so I know there's barriers to accessing in-person therapies, but then there's issues with just completely virtual therapies as well, because you can't necessarily have a physical exam in person. It makes some pain management challenging, but the ease of access is such a huge win for both providers and patients alike. Social aspects, scientists are finding that our links to others have powerful effects on our health, both emotionally and physically. And so it's so important for us to make sure we have strong social connections. So whether that's connecting with community groups like the community that we're sitting here with today, to join online groups, which I know many patients with NF and families are part of online groups, and then joining pain management groups or classes, connecting with friends, connecting with religious groups, and then connecting with family members and caregivers. It's extremely important that on a daily basis, we have some type of connection, whether that's virtual or in person. In person is even better, but it's really important that we maintain those social connections, because loneliness can lead to poor mood. Poor mood leads to worse pain. And again, it's this vicious cycle that's very hard to break out of. There's so much data basically showing, not just how loneliness, like this epidemic of loneliness, but that minoritized groups and underrepresented groups are more likely to be lonely. And this leads to several health issues, including sleep disorders, substance use disorders, neurologic disorders are greater in those that experience loneliness. All right. And then medications, pain physicians a lot of times rely on not just procedures, but medications to be helpful. And there's nothing wrong with adding medications to that toolkit, right? When you think about whole person health, it's actually important that we take a view that's wide and includes medications. So there's going to be multiple different types of medications that I'll jump to here. So for nerve pain, those burning, stabbing, shooting, numbness, tingling, pins, needles, electrical sensations, we have a couple of different medications that we use in our pain clinic: gabapentin, Lyrica or pregabalin, the generic, duloxetine or Cymbalta, nortriptyline, amitriptyline, and then alpha-lipoic acid is something available over the counter as a supplement that our naturopath in our pain clinic utilizes to help patients with nerve-related pains. For muscle, joint, or bone pain, those aching, throbbing, sore muscle pains, or toothache-like pains, Tylenol or acetaminophen, anti-inflammatories like Advil, Aleve, or naproxen, Celebrex, meloxicam, and then again, duloxetine or Cymbalta. We use duloxetine a lot in our clinics because it's a non-opioid pain medication that helps with both the aching, sore, throbbing pains, the muscle, joint, bone pains, but then it also helps with the nerve-related pains, right? So one medication that helps with both types of pains, and it's not an opioid, and it's just taken once a day. The thing that is not great necessarily about duloxetine is that it has to be taken every day. So it's not like when I'm in pain, I take my duloxetine. You have to take it on a daily basis. It has to build up in your blood system in order to be effective. The side effects we actually feel are beneficial because duloxetine is an SNRI, or a serotonin norepinephrine reuptake inhibitor. So it's an antidepressant. So the antidepressant allows you to have the opportunity for a better mood, less anxiety, less depression, better sleep. And then we also prescribe duloxetine for chronic fatigue syndrome. So it gives you a little bit of energy as well. And so although it sounds like it's this miracle drug, by just taking one pill, you can get better sleep, better energy, better pain relief. It doesn't work like that for every single patient. But when it works, it's really, really great. And then SAMe is S-adenosylmethionine. It's another over-the-counter supplement that's available that our naturopath in our pain clinic prescribes to patients with muscle, joint, or bone pain. And then muscle relaxers. This is one that I like to talk about because even physicians have fallen to the advertisements of pharmaceutical companies. Muscle relaxers don't relax your muscles. They are brain relaxants. So they make you feel sleepy, and by getting sleepy, you get relaxed muscles. It doesn't actually work on your muscles at all. It just works on your brain. And these include Flexeril or cyclobenzaprine, methocarbamol or Robaxin, tizanidine, and baclofen. And then we have lots of ointments. There's more and more studies coming out about various topicals and ointments, and people used to jokingly, talk about naturopaths and folks that wanted topicals as lotions and potions. But what we're finding out is that it's more than just potions. It actually works for a lot of patients. And so I've learned from this community about various different topicals that patients have created on their own. They've shared with other patients, and these lotions or topicals tend to work. And so, there's more and more research being done on a lot of topicals, natural things, that everything from looking at beyond just like lidocaine, looking at turmeric, looking at gabapentin as a topical, looking at a lot of natural lavender scents. These things actually can be very, very beneficial. We just need more research done on what settings and in what formulation these ointments are beneficial in. And then last, of course, there's opioids. I think that with the opioid class of medications, at one point we had swung so far where every patient was just getting opioids to treat pain. And then the pendulum swung way too far to the other side to where opioids were being so heavily restricted that patients who had really tried everything and opioids were the only thing that were beneficial, they were still being restricted. Whether it was being restricted by their physician or then being restricted at the pharmacy, they would go to fill the prescription and they're told, we don't have this medication or we can't give you this many pills. We've swung maybe a little too far to the extreme of not being able to provide patients with the pain medications that they deserve. And there's lots of different types of opioids, tramadol, Norco, oxycodone, fentanyl, morphine, methadone, buprenorphine. And you'll see a lot of pain physicians now lean in towards low-dose methadone, low-dose buprenorphine, because these medications, they are long-acting pain medications, and they are less prone to abuse. And once you find a dose that sort of works for you, it continues working at that dose. And then we, of course, have in our world of pain medicine or interventional pain medicine, pain procedures. So spinal cord stimulation, peripheral nerve stimulation, peripheral nerve blocks and ablations where we burn nerves. So if there is a joint or if there is a bone or a muscle or something that hurts that's preventing you from being able to move or causing pain, we can most likely block most joints' nerves and then do a procedure where we burn the nerve that's sending pain signals. It provides temporary relief because those nerves tend to grow back in about 6 months' time. But there's lots of different blocks and ablations that we do. Trigger point injections are super benign and very beneficial for patients. And then we have Botox injections for migraines and spasticity. I put this under other because there's still a lot of research that needs to be done on these two topics. One is low-dose naltrexone. Naltrexone is really interesting. It was originally prescribed for patients to get off of alcohol, opioids, and at high doses. But what we found is that at low doses, low-dose naltrexone at like 4.5 milligrams, it can be very beneficial for pain. It occupies a receptor to where it looks similar to an opioid, but it's not an opioid. It actually helps encourage your body's own endogenous release of opioids. And then it acts like an anti-inflammatory without being an anti-inflammatory. So it doesn't wreak havoc on your GI system by, when you take too many Advils or Aleve. And so it seems like low-dose naltrexone has a very low side effect profile. And so lots more studies are being done on low-dose naltrexone, but it seems like a very good pain medication that can help with both nerve pains and those aching, throbbing, sore pains. Scrambler therapy is super interesting. Scrambler therapy helps with nerve-related pains. We don't understand why. And so it's not covered by insurance. And what we see is that for scrambler therapy, it looks like a TENS unit where you take these sticky pads and you place them over all the areas on your skin or your joints where you're having this nerve-related pain. And when they turn on this machine, it helps scramble pain signals, inappropriate pain signals that are going up the spinal cord into the brain and being processed, and only allowing the appropriate responses. So some patients, when they have neuropathy in their feet, they feel like they're maybe walking on Legos, or they feel like their feet are covered with ants biting them, or they feel just numbness, right? And so after about 5 1-hour sessions or 10 30-minute sessions with scrambler therapy, most patients feel significant improvement in nerve pain in their feet. We just don't know why. And so there's still a lot of research being done on scrambler therapy at Mayo Clinic, at Johns Hopkins, at MD Anderson Cancer Center. And so most of the research continues to show that it's beneficial. We're still trying to understand the mechanism. And then the last piece of this puzzle that we're going to talk about that I understand the least about, and in past years I've talked about sleep, and I've said, oh, you should not take naps because you want to save up all that sleep for the end of the night, and it'll help you sleep better because that's what we're taught. And then I met Dr. Lokhandwala, and I realized naps are a great thing to, and so I am actually going to hand it over to Dr. Lokhandwala to talk about the wonderful world of sleep.
All right, thank you everybody, and thank you so much for being here. As Salman said, I'm here to introduce you guys to the wonderful world of sleep. I am a sleep scientist by training and trade, and so my hope with this latter part of the talk is to really lay the foundations of healthy sleep, but also provide tips to promote and support healthy sleep even in the midst of pain. And a quote that I always like to start with is this one from 1971, which is, if sleep does not serve an absolute vital function, then it's the biggest mistake the evolutionary process has ever made. And it's actually this quote that had me get into sleep science in the first place, because even though it is an old quote, it is one that I think is very worthy of consideration. Because if we count the hours and the days and the years, we actually spend 1/3 of our lives asleep. And so the hope is, it actually is very important because we spend a very long time doing it. And sleep is actually vital to every aspect of our being. It's not just restfulness. It is critical to immune function. So for example, our immune cells, or our T cells, they're at their peak, preferentially, in our lymph nodes, in our blood during sleep. The same goes for hormones and hormone regulation. So for example, growth hormones are actually also at their peak release during sleep. And insufficient sleep or chronic sleep loss can actually suppress growth hormone release, which can be quite critical during adolescence in particular. Sleep is also critical for clearing toxins from the brain. And these are proteins like beta amyloid and tau. Now, if these proteins sound similar, it's because these are the proteins you find in Alzheimer's patients. And this is what builds up in their brains and leads to that dementia-related symptom that we see. But what happens during sleep, again, is that beta amyloid is cleared out of our bodies. It's cleared out of our blood. All the waste that we have accumulated during the day is cleared out. So you can imagine that insufficient sleep chronically can build up toxins in our brain and our body. We talked at length about mood regulation, but sleep is critical for that. I probably don't have to say that to anyone here. Just one night of bad sleep, of all-nighter, we are not our best selves the next day, probably for the next few days. Maybe that's just me, but sleep is also very critical to learning and memory. There is a number of studies that show that not just sleep as a construct, but brain activity during sleep is so important for consolidating and for strengthening both our short and long-term memories. And so it's not that I really needed to convince you that sleep is a good thing, but here's just a short list of why it's important. But the real question is, well, how do I get good sleep? Especially when the relationship between sleep and pain is such a vicious and such a bidirectional relationship. So we can imagine that when you're not getting good sleep, you're actually going to be aggravating pain. And when you're in pain, it's so hard to initiate sleep and maintain sleep. And so right now it just feels like, well, this is just a vicious cycle that I have no control over. But actually, there are many factors aside from pain that impact sleep, both impair it and improve it. And these are factors that I'll walk us through today that are much more in your control. And the hope is that with these factors being addressed, you have the optimum chance for getting a good night's rest. And that's what we really want. Now, before I get into all those factors, I did want to make a plug that there is a growing number of research, growing literature, specifically looking at the relationship between sleep and pain in NF. And these are just a few papers out, but what's really exciting is that there's more to come, which is very promising. So now to the factors that actually interact with sleep. Now, this list may seem intuitive, and some of these items might not seem as intuitive, and we'll go through each one. The first is light. Now, I know light is usually seen as this complete monster when it comes to sleep, especially when we tag it on with point number 2, which is technology. And the reason being is when we have our phones, when we have our screens or TV, we are emitting blue light to our retinas. And that's usually the light that people are talking about as being detrimental. What blue light is part of our visible light spectrum that actually tricks our brain into thinking that it's daytime. And what happens when our brain is tricked into thinking it's daytime, our body stops producing and releasing melatonin, which is our sleep hormone. And so that is usually what we hear when it comes to light and sleep. But there is another part of light which is actually quite beneficial, and that's natural morning sunlight. We always hear that getting sunlight or going out is good for us. We need the vitamin D, but it's also very important within the context of sleep. So even when we get up in the morning and just getting even 10 minutes of direct sunlight, this doesn't mean looking straight at the sun, because that probably causes more harm than good. But it's also not passively looking at the sun through a window. It's you physically going outside. And what that 10 minutes of daily sunlight does is it tells our body's natural rhythms, what we call circadian rhythms, and that includes our sleep-wake cycle. It tells us, okay, it's daytime. It's time to be awake. It's time to be alert. And it suppresses the production of melatonin. And when you do that enough, it really entrains your circadian rhythms to understand that, okay, this is not the time for melatonin to be released, which is great because our bodies love routine. They love a schedule, and I'll be hammering that idea much more as we go on. The next is caffeine. Now, caffeine seems very intuitive. It's caffeine. It's a stimulant. But what caffeine does in the brain is that it actually blocks the receptors that cause and promote sleepiness. And so you're not only kind of hampering down on these sleepiness receptors, what we call adenosine receptors, but what we have to be careful about with caffeine is its half-life. Now, caffeine has a half-life of 6 to 8 hours. And what that means is if you have a cup of coffee at 2 p.m. to wake you up after lunch to kind of get you through your workday, 6 to 8 hours later, so anywhere between 8 to 10 p.m., you still have half of that caffeine still circulating in your body. And so if that's the time you're hoping to rest, wind down, you still have caffeine pumping through your blood. And So it's not necessarily that you cut caffeine completely, though that might be ideal for some. But it's really thinking about the timing of caffeine consumption that is going to be important. The next is digestion. This one might seem a little less intuitive. And when we eat, our body obviously has to kind of reserve energy to digest. And that can take several hours. But what happens during sleep is digestion actually slows down. And so if you were to eat a meal, let's say 2 to 3 hours before bedtime, what's happening now is your body's natural process of sleeping is now at odds with your stomach's need for digestion. And when these two things collide, what you then get are sleep disruptions. You get things like indigestion, acid reflux, etc. And so again, really timing of when you eat and when you drink is going to matter. Next is temperature. This also might seem less intuitive. The optimal sleep temperature is anywhere between 65 to 68 degrees Fahrenheit. And the advice that I've always been given from mentors and from research is that it's better to be in a cold environment and layer on, so wearing sweaters, having multiple blankets, versus being in a hot environment where you have to rip off layers. You want to decrease your body's temperature because that's optimal for relaxation. And that goes with the next point, which is your environment. Not just your physical environment. It's not just the temperature. It's really being in a physical space and a psychological space that is fit for rest. So if you struggle with mood or anxiety disorders or depression, I understand that this can be a challenge. Even if you don't have these challenges, if you are just in bed ruminating what you did in the day, what you didn't do, what you have to do, what you said, what you definitely should not have said. If you're ruminating about all these things, you have now created a psychological environment of unrest. And so these are all factors that we might not think about as a day-to-day, like this is disrupting my sleep, but actually it is. And so it probably makes sense that there are so many sleep disrupting activities that we're doing on a day-to-day basis without even knowing. For example, working until bedtime. And if you're working until lights out, you have extended the amount of time you've probably given yourself exposure to blue light. Doing other activities, not just work, but eating and watching TV in the bedroom. Now, this is more of a modern world problem because we now have televisions in our bedrooms. We take our phones in our bedrooms. We are eating, we are binging, we are just having the best time. But really, truly, the bedroom should only be dedicated to sleep and sex. Anything outside of that needs to be outside of the bedroom. So all these other activities like screens, worrying, ruminating, you have now created a very unrestful environment. This also goes for other activities that might not seem as intuitive, which is exercising, specifically vigorous exercise within 1 hour of bedtime. So for some people, this might be a relaxant, but what's happening scientifically when you are exercising vigorously, going for a run right before bed, you're heating up your body. And if the goal is to actually lower body temperature, you're not helping yourself by heating it up. Next, we have talked about digestion. So really thinking about when you're drinking, when you're eating, because when you drink too many fluids before bed, inevitably you'll need to get up in the middle of the night, go to the bathroom, and you're lucky if you can get back to sleep. One that is also less intuitive is varying your bedtime by more than an hour across the week. This is more of a biological, real challenge for adolescents, and I can talk on end about this, but this can go for anybody at any age, which is when you are forced to wake up before your body can naturally wake up. So usually for school or for work, and then you are working long past you normally would work. You do that for 5 days a week. And then come the weekend, you just catch up on all your sleep. You're like, great, I'm going to sleep for 15, 20 hours. We're doing solid. And there are two things to that. One, you can't ever really catch up on sleep. And we can also talk on end about that as well. But the second thing is, As I've mentioned, our bodies love routine. They love to know what's coming next. And when our bedtime and wake time are out of sorts, it doesn't really know how to help you. And so the best we can do here, and as much as we can, is to keep bedtime and wake time as consistent as possible on the weekdays and the weekends. The next is naps. And again, naps I can talk about forever. And so it feels blasphemous just to have 2 points on naps here. But very quickly, if all you want is a good, quick burst, you just want to like release your fatigue, and you just want enough to kind of get through the day, no more than 20 minutes. Anything more than 20 minutes, it's kind of a toss-up in terms of alertness and fatigue. So it's very individual after 20 minutes. But also taking naps right after dinner or very close to bedtime is also something that will just very much kind of break and fragment that sleep cycle of ours. And so what can we do? I did talk about some of the things we already can do, but I will really hone in on this idea of having a routine. A daily, regular bedtime routine to wind down is so important. And you can make this fun. This can be, brushing your teeth, wearing your favorite set of pajamas, doing your skincare, reading your book, anything to eventually to do one consistently. And when you do it consistently, your body now understands that as a cue. It's like, okay, we're brushing our teeth now. Like, okay, we're winding down, we're getting there. And over time, it is incredibly sleep promoting. The next is low stimulus activities, audiobooks, drawing, meditation apps, maybe even a bath. Now, I know I talked about kind of putting away those screens, and audiobooks and meditation apps tend to be with screens involved. But the hope is that once you've turned it on, you can just turn your phone with the screen down so you're not getting that blue light exposure. Next is really creating a room for sleep, a distinct place that is ready just for you. If you are in a situation where you've done everything, you've winded down, you have your routine, you're ready to go, and now all that's left is you ruminating. You're thinking about everything you have to do, and you can't, your brain just does not shut off. If you're ruminating for more than 20 minutes, if you're worrying in bed for more than 20 minutes, get up. Get up and leave your bedroom, walk around, and when you're ready again to, let's say, fall back asleep, come back to bed, find yourself ruminating more than 20 minutes, get back up again. But do not make your bedroom a place where it is a consistent spot for rumination and worry. But now, how can we tailor sleep hygiene specifically for pain? And so we know from research that those that suffer from chronic pain are much more vulnerable to being disrupted by sounds in their environment. And so something that might be worth investing in or looking into are white noise machines. Now, it doesn't have to be white noise machine. It can be any color spectrum machine. It can be pink, it can be brown noise. But the hope is that you've found a timbre that's consistent and that's in the background, that's non-disruptive, that just feels like background chatter. White noise, I akin to most as being like a low-grade vacuum that's just playing in the background. Pink noise is more of gentle rain falling, while brown noise is kind of waves crashing in the ocean. So choose as you will, because they can be great and very beneficial. Now, I also know that I've been talking about decreasing body temperature this whole time, that you want to cool your body. But recently, I was actually in a talk where they shared research and data where possibly passively increasing body heat can add up to 20 to 30 minutes of deep sleep. And so this might look like, for example, a 30-minute hot bath, roughly 2 hours before bedtime. You've kind of relaxed your muscles. And what they found in that particular study is that it increased deep sleep by 20 minutes. And deep sleep is actually where all those important factors occur. Your immune function, hormone function, mood regulation, learning, memory, all occurs during deep sleep. So the more you get, huzzah. The next is, the study also found that this particular passive heating of the body also decreased pain amplification, which is wonderful. But again, this was one study that I was exposed to. So there are a lot of individual differences. So if cooling your body doesn't work, perhaps passively heating the body is something to also look into. The next is exercise. So I said that vigorous exercise might be something that we want to stray away from because we don't want to heat up the body too much. So aerobic exercise might be a wonderful alternative. Gentle stretching, gentle yoga. Pacing is critical in this case because we want to avoid pain flares. And of course, in this case, it's very important to listen to your body. And then we talked about therapy a bit in Salman's portion, but adding relaxation therapy and cognitive restructuring into your sleep routine has been shown to be highly beneficial, particularly for catastrophizing and kinesiophobia, which is the fear of movement, the fear of getting hurt by moving or going through physical activity. And lastly is melatonin and light therapy. And I have a question mark here because even at the best of times, melatonin for the average person might be a toss-up. The same with light therapy. And so these two things are very important if you wish to pursue, to do it in conjunction with your physician or a counselor or a therapist as well. And so I know that we've gone through tools already, but I do want to make another plug for Headspace just because they have wonderful courses on sleep and particularly have a course or two on pain and sleep, which I have been told is quite interesting to look into. But there's also the sleepfoundation.org website. This website is chock full of information, not just about sleep as a construct and the different brain activities that occur during sleep, but also a lot of relaxation exercises that help to fall asleep as well. And there are a couple apps that I personally haven't tried, but I've heard about as being very beneficial, which is Sleep Cycle and Pizzazz, which is, of course, open to try if you're interested. And with that, thank you all so much for your time, and we're happy to take any questions.
To the sleep apps, and I have word retrieval issues. The calming apps, they're all for meditation. Do they all require hearing?
That is a great question. To my knowledge, they do.
Yeah.
But I don't know if someone you know any different.
Yeah, I think that Sanna's right. Yeah, I think that they all do. But one of the interesting things is Headspace. And
Thank you.
They acquired Ginger.io. They actually are very responsive to people reaching out. So if you need any adaptive tools, they actually will respond to individual users and patients.
My question is, I completely agree with you that we have swung way too far in the other direction about opioids. Because for a lot of people, like for me, for example, I have tumors pressing on the spine of my back. No amount of kale is going to make that go away. What are some things you can do to help change the mindset of the world to make opioids much more readily available?
Yeah, so there is a lot of great work being done by the U.S. Pain Foundation, which is a patient-facing group that advocates on behalf of patients with chronic pain. I'm a chronic pain patient myself, and so really advocating for yourself to your physician that I have tried X, Y, Z. I find that this is what is beneficial to me. I have been very compliant. You may be asked to sign pain contracts or give urine drug screens and jump through all these hoops and hurdles, but so many of our patients are super compliant with these regimens that they're provided. And if they are super compliant, there's no need or reason to take them off. And even the CDC acknowledged just a few years ago that they found that, when they said that, we should be tapering everybody off opioids, it led to a lot of patient deaths and suicides, and so it was such a stark shift that they actually, within a year, said, we apologize, we gave the wrong guidance, and let's actually, we don't need to taper patients. They should work directly with their physicians to figure out a regimen that works, and that for non-malignant pain, that patients can do what we call 60 milliequivalents of morphine. It's, every single thing that we talk about when we talk about oxycodone is 1.5 times morphine. So there's all these calculators that you could do and look up. And as long as you're within that range, your physician should feel comfortable prescribing. There's a whole different layer when you get to the pharmacy. Now, even physicians, we have barriers with insurance approving these medications. And sometimes the pharmacy or the pharmacist may tell us that they won't fill a prescription.
I had a pharmacist one time tell me, I'm not giving it, even though he talked to my doctor explained why I needed, the physician said, you don't look like you're in pain, I'm not giving it to you.
And I've heard that time and time again. And it's because pharmacists are now critical to helping with the opioid epidemic, but they've also then swung themselves to getting involved in patient care when they don't know the patient necessarily, right? And so we are trying as much as we can to advocate that if you're a physician and you feel like this is what's appropriate, that you deserve this treatment, right? And that there shouldn't be, as long as there's, your pharmacist can look up every prescription that you've taken and that you've taken it on time, that you're not getting early refills. This is what pharmacists get worried about. And that's where they should be most involved is if they're seeing red flags, which is, why is this patient getting so many frequent early refills, right? This prescription should have lasted 1 month. They're coming back in 1 week. That's where pharmacists, get involved. But if a patient is super compliant and on the schedule of refills, then I still have seen pharmacists get involved and say, I'm not filling prescriptions. I've had to call pharmacies on behalf of patients to find a pharmacy willing to prescribe. And so the entire system has kind of gone a little too drastic in terms of trying to protect patients, but in fact causing harm to patients. And so joining some of these patient-facing pain groups has been very beneficial to advocate on the Hill. So that, legislation doesn't go against patients and their care. Yeah. Yeah.
I'm curious, Jack, you said to avoid red meat. I'm curious, do you mean all red meats or specific kinds? And I ask because I consume red meat on a regular basis, and I found it to be quite beneficial to help me achieve my goals.
So this is, I'm super happy you brought that up. So, when patients actually ask me now, what is the best diet? I actually don't tell them don't eat a bunch of red meat, go to a vegetarian or vegan diet. I tell patients if you can eat a minimally processed diet, right? I've seen patients with psoriasis, psoriatic arthritis benefit greatly from just consuming a diet of mostly meat and red meat. And so, but what we do see is that, there's so much discussion about cholesterol and about red meat. And what we're finding is that may not be as true or as important of a connection as we think it is. And so when we think about things such as omega-3s versus omega-6s, there's a lot more that we don't understand than we do. And I think that we have to look at where a lot of the funding for some of this research comes from, because we as clinicians are also then using the literature that we have to pass on to patients. And we're finding that a lot of the literature that we've had from the past may not actually be as accurate or appropriate. I think the research on red meat, a lot of times, if we take a look back at the Atkins diet, right, before keto became this super popular thing, you look at the Atkins diet, people were eating red meat for breakfast, lunch, dinner. And then Atkins himself died of a heart attack, right? And so people were like, oh, this is actually a super dangerous diet. And people swung the other way again and said, oh, red meat is dangerous. I think that you're 100% right, that we shouldn't say all red meat is bad and that, you shouldn't be eating red meat. It's the literature informs us to be somewhat cautious because of cholesterol, but I've seen patients who have switched to a completely meat-based diet, have plenty of red meat in their diet, and it's been extremely beneficial for their pain. So I just tell patients, it doesn't matter whether you go vegetarian, vegan, or completely meat-based. It's really trying to avoid ultra-processed foods and eating minimally processed foods. So if meat is that, then great. Yeah, if it works for you, I don't want to tell anybody how to live their life. If it helps you, do it. Awesome. Yeah.
I've heard that protein is very beneficial in healing. How does it work with pain?
Yeah. So when we think about when we're lifting weights, right? We get small little tears that, I'm trying to simplify things. And in order to build muscle, we need protein, right? Protein is what helps build muscle. So there's a lot of benefit from protein in like satiety, right? Just helping us feel fuller. When we eat carbs, we get blood sugar spikes, and then we get these blood sugar crashes, and then we feel hungry again. So protein is beneficial in helping us stay satiated for longer, but then it also helps in healing. And so when we think of wound healing, if somebody has a bed sore from staying in bed for too long and they develop pressure ulcers, the thing that dietitians and nutritionists really encourage and recommend is we need to increase this person's protein intake to help heal this wound. And so in that's one instance. And then, that idea of lifting weights when we have this desire to increase muscle strength, right? In order to do that, we not only need to lift weights or do strengthening exercises, but we need to consume protein in order to fill in whenever we have these tears and our body rebuilds, it needs protein to fill those tears to help us get stronger.
In a previous lecture, they talked about ADHD.
Yeah.
And how one of the symptoms or one of the common features of people with ADHD is that they don't get enough sleep. And I'm looking at some of the things that you've identified in one of your slides as why we need sleep. And one of them is learning and memory, which is also an issue for ADHD. Has anyone done any studies to see whether or not they can get people with young kids with ADHD to sleep better and maybe resolve some of the ADHD behavior?
Absolutely. That's a fantastic question. And actually, where the lab that I did my dissertation in actually had someone prior to me look at particularly that question. And but I'll preface really quickly, when it comes to young kids and sleep, what's very interesting is that when kids don't get enough sleep, the behaviors that they exhibit, not just their physical behaviors, but their mood, their learning, how they are in school, their academics, is all very reflective or symptomatic looking as someone with ADHD. And so when a child doesn't have good sleep, whatever parents are seeing as a byproduct of that, they assume is ADHD. And so sometimes it is not ADHD, it's sleep. But of course, when there is ADHD, it is a bidirectional relationship where sleep is compromised. And there has been studies done where they've done sleep extension experiments. So they've taken an individual, a child or an adolescent with ADHD, and what they would do is that they would give them, let's say if they would typically sleep or attempt to sleep 7 hours, they would extend that period to 9 hours. And what they found is when a child with ADHD is able to consistently follow that sleep extension paradigm for at least a week, they're on a learning and memory task. When you compare it to a typically developing child, their scores are similar, that there's no difference, which is very promising. There are a few studies that have looked at that. And so when you have an individual with ADHD, something that I am prompted to suggest is just increase that sleep opportunity window and really make a routine out of it. Individuals with ADHD really thrive on routine as much as possible as well. And so if you're able to extend that window, you might actually see outcomes to learning and memory that might be similar to someone that's typically developing. It's a great question.
And the other, just follow up, and one of the things you says it helps with cleansing your brain. Have they discovered that it cleanses any other parts of your body of toxicities?
Absolutely. So I know they, aside from the brain, it is our lymph nodes and our peripheral blood that I know is cleared of toxins as well. Those are the three areas that I'm aware of personally. And I will say they're also the biggest ones because they work, our brain actually works harder when we're sleeping than when we're awake. People tend to think that our brain shuts off, our body shuts off when we're sleeping, but it's our brain that's working incredibly hard. It is playing back our entire day at like 10,000 times the speed so that you're able to remember things. You're able to kind of take from it what's important for survival and for daily activity. And so I would say, in terms of clearing the toxins, our brain and our lymph nodes and our blood are going to be the three big ones. Yes.
Thank you, everybody.
Thank you so
Appreciate y'all.
much.